How many of you have gone to a doctor's and a nurse has taken your blood pressure or pulse? Many of you may not know how to take someone's blood pressure or pulse. I am Brittany Beyer, and I'm going to show you how to take someone's blood pressure and pulse. It is important to know how to take someone's blood pressure and pulse in case of an emergency. I am Asina. I have researched and have been taught properly how to take someone's blood pressure and pulse. First, I'm going to show you the equipment used. Secondly, I'm going to tell you the steps needed to take. And thirdly, I'm going to demonstrate how to properly take someone's blood pressure and pulse on somebody. The first thing I'm going to show you are the materials that will be needed to take someone's blood pressure and pulse. There are a few different materials needed to take someone's blood pressure and pulse. The first thing you will need is a blood pressure cuff. There are manual blood pressure cuffs and there are electronic blood pressure cuffs. You will also need a stethoscope, and lastly, you will need a second hand watch. Now that I have showed you the proper equipment needed, I will now talk you through the proper steps to take someone's blood pressure and pulse. There are many steps that need to be taken to take a person's blood pressure and pulse. For blood pressure, the first step is to pick an arm. If a person has breast cancer, you need to use the opposite arm. Place the cuff on the arm. According to Suntech Med, the best place is between the bicep and tricep. Also, according to Suntech Med, the artery needs to be placed on the artery. Then place the stethoscope below the cuff. You would then pump the cuff to 180, then let the air out slowly, listening for the beat. The very first number the beat is on will be the top number, and the last beat heard will be the bottom number. Here are steps for pulse. With the pulse, you take the person's hand with one of your hands. With your opposite hand, you take your index finger and your middle finger and feel for the pulse in the wrist under the thumb. Once you find the pulse, you look at your second hand watch or clock and count every beat for a minute. You can count up to a minute or count for 30 seconds and multiply the number by 2. But Lisa from Church Training Institute says you should not do that until you are comfortable counting for a full minute. Now I'm going to demonstrate how to take blood pressure and pulse. Now I'm going to demonstrate with a manual blood pressure cuff. First, we're going to take the cuff and put on his arm, making sure the artery mark is around his artery. Then we're going to take the stethoscope, put under the cuff. We're going to then pump the cuff to 180 and slowly let the air out, listening for the first and last beat. And since the first beat I heard was on 116, that's going to be the top number. And because the last beat I heard was on 68, it's going to be the bottom number. Now that I have showed you the manual one, now I'm going to show you the automatic blood pressure cuff. First, we're going to put it on our arm, making sure the artery marking is on the artery. And then we're going to press the button to start it. With the automatic blood pressure cuff, it automatically gives you the top number, the bottom number, and also the pulse. Now I'm going to demonstrate how to take somebody's pulse. This is my second hand watch. Okay. So you're going to take the person's hand with your index finger and middle finger. You're going to go on the wrist, below the thumb, and feel for the pulse. And once you find the pulse, you're going to count every beat you hear for a minute. First, I showed you the equipment needed to take someone's blood pressure and pulse. Second, I explained the steps that needed to be taken. Lastly, I demonstrated how to properly take a person's blood pressure and pulse. It is important to know how to take blood pressure and pulse so that in case of an emergency you can perform it. Even though you go to the doctors to get your pulse and blood pressure checked, now you can do it at home.